Hello everyone and welcome to AceOSCE's OSCE video for today. My name is Alicia and thank you for joining me for this practice OSCE video. In this video, I'm going to be trying to show you how the CPS looks like, how we can use that as a reference and give you some tricks as to how to maneuver through the CPS. Now, most of you have joined us on our Facebook group, which I really do appreciate. I have recently made an OSCE group specifically for our OSCE people. I am getting more and more people who want to prepare with us for the OSCE, which is great. Keep an eye out for more and more videos. Just make sure that you are a part of both our evaluating exam as well as OSCE groups. It is a good idea to revise your basics with the daily or regular questions that I post in our evaluating exam group. And for people in the evaluating exam, it is a good idea for you to join our OSCE group as well. That way you know what you're heading for, because you will eventually be giving your OSCE exam. So you know what you need to be prepared for and how the OSCE actually looks like. For the most of the people that I was studying for the OSCE with, for people who I'm helping to prepare for the OSCE, I realized that when you have a short reference, a small reference, maybe 2 or 3 pages long, it's really easy for you to maneuver through the reference and get me the answer for the OSCE case. However, when the reference is longer, especially like a CPS monograph, which, as you guys know, is the Bible for our monographs that we follow for our daily pharmacy activities, it is hard for some people to maneuver through those. So how to read through a CPS monograph is something that I'll touch base on shortly, as to what sort of different topics can come in. Also, make sure that more and more people are coming up to me and telling me that a lot of cases are not having patient profiles, which means that the OSCE people want you to get the profile, so don't be unfazed, we'll go through it together. So here is the electronic version of the Butrans 5 CPS monograph. Usually in the OSCE cases, you will be getting a paper form of this, but at least here we can discuss the table of contents and what specific information is given in which topic and what topic comes after the other. In most cases, you're going to see the indications topic the first. This includes all Health Canada approved and off-label uses of the medication. The next one is going to be contraindications, so where we cannot use the medication at all. The third one is serious warnings and precautions box. It may or may not be in a specific medication depending upon how harmful or how potent it may be in terms of its toxicities. So all black box warnings and life-threatening conditions are right here. Dosage and administration are going to be the doses of that medication for a specific indication, what sort of dosage adjustments you may need in terms of age or kidney function, and administration, for example, if a vaccine, so IM IV. Next comes overdosage, which is going to be dealing with how you can manage an overdose or taking inadvertently an increased dose of the medication. The next is an important topic of dosage forms, strengths, composition and packaging. So what sort of composition of a medication is there, any allergic substances, so the patient may not want to take that specific one. Then comes warnings and precautions, so all your side effects, your special populations, your adverse reactions, which is your side effects, drug interactions, especially for people on multiple medications, actions in clinical pharmacology, which you guys know already, and then comes storage, stability, and disposal, especially for vaccines. So let's get started today. A doctor is coming for your advice. Do as you would in your regular practice. So here we're getting a healthcare professional, so you can definitely ask extra information about their liver function, kidney function tests if you'd like. You can use your medical lingo. This is about a patient, so make sure that you make a mental note to not talk to the doctor as you, but you talk to them with a third person, so that you know we're talking about a third person here. You also want to keep in mind that you may or may not get a patient profile, so keep in mind of all the questions that you may need to ask to retrieve a patient's profile. In some of these cases, you will get CPS as your reference, so be prepared to go through a potentially long reference. But once you guys have enough practice with the CPS, you'll know where to look for the answers, especially when it comes to the basics of drug dosaging and basic adverse reactions. So keep practicing with the CPS for as much as you can. That will enhance your knowledge about basic medications, as well as it will help you maneuver through the CPS in a better manner. Once you hear the bell, go inside, be confident, and introduce yourself. Hello, doctor. My name is Tina. I'm the pharmacist on duty today. How could I help? Hi, I'm Dr. Jones. I'm just wanting to get a recommendation from you about our mutual patient. For sure, doctor. I do appreciate you coming in today. Please have a seat. How could I help? So we have a common patient. She's a cancer patient, and I've prescribed her the medication Butrans 5. She's been stable on it for the past few months. However, I'd like to give her more flexible dosing, so I was hoping to see how we can discontinue that and add on some other IR options. For sure, doctor. I would definitely want to help you out with that, Dr. Jones. I just don't see a patient profile on my OSCE station here, unfortunately. Could I ask you a few questions regarding the patient so I can give you a better recommendation? Yes, for sure, go ahead. Perfect. What's the patient's name and age, doctor? Her name is Mary Dembe. She is 85 years of age. I see. And what was the diagnosis for which she was given the Butrans? It was ileal cancer. It was diagnosed about 6 months ago. I see. Any allergies she has? No, she has no medical allergies. Okay. Any chronic medications, any over-the-counter or herbal medications she takes? I'm her oncologist, so I'm not aware of that. I see. I'll make a note of that. Any liver function or kidney function compromise that I should be aware of? No, as of the moment, it's all okay. That's actually one of the reasons why I want to stop the Butrans for her. I see. Okay, I'll keep that in mind, doctor. Anything about her smoking status or alcohol intake that I should be aware of? No, she's quite old and she's in a hospice, so I don't really think that would apply. I see. I appreciate that, doctor. Can I just look into my reference before I give you my recommendation? Is that okay? Yeah, for sure. Actually, before I go into my reference, I wanted to make sure if you have any other questions for me, so I can probably answer those as well. Yeah, I was just hoping to see, because she is established in the Butrans therapy at the moment. Can the Butrans patch be actually used as a PRN analgesic as well? Oh, that's a good question, doctor. I'll keep that in mind and I'll try to answer that for you as well. Any other concerns you have for me? No, that's it for now. Perfect. Just give me a few minutes. I am going to be referring to my reference and I'll get back to you shortly. So, of course, before you go into a reference, always let the doctor know so they know that you're not just ignoring them. And in case they say that I don't have information about this, it basically means that that information does not apply to the case. So that's okay. Looking at your reference, this is a copy of the CPS in the electronic version for Butrans. Under the dosage and administration topic, you'll see a little topic called discontinuation of Butrans therapy. Here the doctor asks what we can do in order to smoothen the discontinuation of the Butrans for the patient. Therefore, this is the topic we want to look at. In here it says, after removal of the Butrans patch, the plasma concentration decreases gradually and the analgesic effect is maintained for a certain amount of time. This needs to be considered when the use of Butrans is to be followed by other opioids. As a general rule, a subsequent opioid should not be administered within 24 hours of removal of Butrans patch. As part of an overall strategy to suitably manage pain in this period, the use of appropriate rescue medications and or careful monitoring during this time should be considered. The buprenorphine concentrations will decline, decreasing approximately 50% in 12 hours. So here we can definitely let the doctor know that we can stop it. However, the rate of decline of the medication is low. Therefore, we cannot institute an IR formulation within 24 hours. You can look through the reference to see what are the other potentials that you may use in order to manage the decrease in dose of the buprenorphine. However, for the 24 hours of removing the patch, we cannot instill an IR. This is the crux of this case. Adjustment of reduction of dosage is the next topic. However, we are not reducing the dose, we are just stopping. So this probably does not apply here, but you can definitely read through that in case you do want to do that in your OSCE station and if you have time. The second question the doctor had was regarding if it could be used as a PRN analgesic. Out of common sense, we probably would know that a patch is not usually something that we can use in for PRN dosing, because it is formulated to release the medication over a specific period of time and it constantly keeps releasing it. However, I've always said and emphasized that all your prior knowledge and common sense, keeping in mind, should be used only when you cannot find the answer at all. And even then, maybe if you can't find the answer at all, it's better to tell the doctor to wait and that you call them back rather than giving them the wrong answer, right? So let's try to find it in the reference as to if it can be used as a PRN analgesic or not. So the two places where this could be written is either in dosing, so how can we dose it, can it be dosed PRN or not, or it can be written in the indications to see if it can be used as a PRN alternative. So let's have a quick look as to the indications here. So right in the indications, it specifically says that Butrans is not indicated as needed PRN analgesic. So as most of us thought and as our common sense said, it specifies here that it cannot be used as such. So that is a good thing that we did corroborate that with that reference. So prior knowledge, all power to that. However, in certain cases, I've actually seen that some references actually say that, it's okay to be given as PRN analgesic or something just because it was based on a study. So depending on what sort of reference you get, that is the answer you want to give, because that's what the OSCE assessors want to see. They want to see how you interacted with the doctor. They want to see what sort of questions you asked. They want to make sure how confident you are in answering your questions. So make sure that when you're reading out the answers to the doctor or to the patient, you're not just reading out line by line from the reference. Try to make the answer your own. Try to look at them and answer them. Thank you so much for waiting there, doctor. So I was just looking through my reference, and it does state that after we remove the butrans patch for the last time, we should not be instituting IR therapy right away. We do need to wait for at least 24 hours before we can institute such a therapy, just because it may take some time for the buprenorphine decline therapy to happen itself. It does take a little bit time for it to get out of your system, which is why it is a good idea to wait for about 24 hours. Did I answer your first question? Yes, you did. Okay, thank you. The second question you had was regarding using the butrans patch potentially as a PRN analgesic. As we all know, it is a transdermal patch. It is going to be a better idea, and it is, I just want to correct myself. It should not be used as a PRN analgesic. So we cannot use that, unfortunately. In case you'd like some other options from me as to what we can substitute that with after 24 hours of stopping butrans therapy, I can look through my other references potentially and give you a call back in a few minutes. Would that work for you? Yeah, for sure. Perfect. Do you have any other questions for me today, doctor? No, I don't. Okay. In case you do have any further questions for me, definitely give me a call back. And I definitely want to help you out with that. And thank you again for coming in. Have a good day for yourself. Thank you. So just a couple of quick tips, guys. Some people may ask you the 2-minute question at the 2-minute bell, which is why we ask them before going through the reference if they have any additional questions. That saves us time because we know what we're looking for in the reference. I hope this case kind of helped you guys out. The tips and tricks helped you guys out. I just wanted to let you guys know that once the OSCE batch for this month is done, I think they've got their exam in end of May. I have slots open in for more OSCE people to come in so I can prepare you guys better for the OSCEs. It is a good idea to have good, steady, constant practice from day one instead of just, starting 10 days before the exam. It is hard for me to kind of train such people, so definitely reach out to me. We can practice more such cases and I can share more tips and tricks. So stay tuned for more such cases and I'll see you in the next one.